These are some of the things you can do for your minor wounds at your home. Stop bleeding by lifting the injured areas to a higher place. Apply pressure to the injured area, using clean water. Wash the wound to remove dirt and debris. Put a bandage to protect and cover the wound. Replace the bandage when it loosens from the skin or the absorbent pad is filled with drainage. If the wound is deep or if it needs stitches, consult a doctor. Before and after you touch your wound, wash your hand. Wear gloves if you touch someone else's wound. Remember, some redness, pain, swelling are common with all wound. It will go away. Proper way of using a bandage. Because tension damage the wound, do not pull on the bandage tape. Apply tape gently, because sudden removal of the bandage caused damages to the skin. 2. Remove a bandage, push down on the skin and slowly lift the tape. And, you should follow the direction of the bandage manufacturer. Contact a doctor if you have a traumatic injury which requires stitches, or if your minor wound would not stop bleeding after 10 minutes of you applying pressure to it, or if you get burned, and the burn caused blister or skin loss, or if you get an insect bite that become dark in the center or very red and swollen, or if you get bitten by human or animal, or if your wound get infected, thick drainage, increasing redness or swelling around the wound, severe pain, fever, and chills are signs of infection, or if you have not have a tetanus shot within the past 5 years, or if you have an unexplained wound or one that is not healing as expected. Granulation. For certain types of wounds, a doctor make deep surgical incisions which are sutured in the deepest layers, with the upper portions left open to allow fluid to drain and to prevent formation of an abscess. Treatment of chronic wound. A doctor will ask you how the wound started, how long you have had it, how it has been treated, your general health and any medical conditions you may have. The wound and the surrounding area will be examined and measured. A doctor might perform diagnostic tests like X-rays, MRI or CT scan, vascular studies, blood tests, samples of fluid or tissue from the wound might be taken, and oxygen pressure measurement. The doctor might show you how to clean your bandages. He or she might debride your wound, which means the doctor removes dead tissues and debris from your wound. You might be referred to a specialist like dermatologist, dietitian, infectious disease specialist, podiatrist, rheumatologist, surgeon, or a wound care nurse. Factors that affect wound healing. Things that slow wound healing. Overuse of harsh antiseptics like hydrogen peroxide and povidone iodine. Poor nutrition. Smoking. Untreated infection. Uncontrolled diabetes. Diseases that affect the immune system. Use of medications like steroids and anticoagulation. Continued injury to the area, and failure to treat the cause of the wound. Luckily, there are many things that speed up wound healing. Treating the cause of the wound, preventing further injury to the area, improving your body's ability to heal, treating the infection, if it get infected, removal of necrotic tissue, if it is present, cleansing the wound with saline or non-toxic wound cleansers, say dressings that provide a slightly moist wound surface. Now, I will teach you about 3 specific types of wounds. First, I introduce you to pressure ulcer. A pressure ulcer is an area of tissue that is damaged when soft tissue is pressed between a bony area and another surface for a long time. It commonly occurs over bony areas like tailbone, buttock, hip, or heel. It usually happens in people who cannot move themselves around because of illness or injury. The amount of skin damage depends on the amount of pressure placed on the area, the length it is pressed, and the person's overall health. Pressure ulcer can take weeks and months to heal. It is always better to prevent an illness than to treat one. This is how pressure ulcer is prevented. Inspect your skin daily while paying special attention to high-risk areas over the bony areas of the hip, tailbone, heels, elbow, and ankles. If you see red areas appearing, turn more frequently and use a softer bed and cushions. Do not use heat lamp and do not massage it. Clean yourself good. Use protective cream to treat excess body fluids like urine in areas that is exposed to it, and see a doctor. Try to change position every 2 hours or so. When you move, do not drag your skin across your bed. Try lifting your body parts. Avoid lifting your head more than 30 degrees for too long. Make sure you eat well, and intake good nutrition. However, if prevention did not work, here is pressure ulcer treatment. When pressure ulcer occur, see a doctor. Remember to do the following. Try not to place pressure on the injured area. Watch other sensitive parts of your body to prevent pressure ulcer from developing in other places. Eat well and have plenty of rest. Keep your wound area clean and bandaged. Stages of pressure ulcer. There are 4 stages of pressure ulcer. Stage 1, erythema, redness or discoloration of the skin that does not blanch when pressed. Other indicators are swelling or edema, and induration or hardness. Stage 2, partial thickness, you lose skin in the epidermis and /or dermis layer. The ulcer look just like an abrasion or blister, or shallow crater. Stage 3, full thickness skin loss through both the epidermis and dermis layer. The subcutaneous tissue is damaged. The ulcer looks like a deep crater with or without undermining. Stage 4, full thickness with extensive destruction and damage to muscle, bone or supporting structure. The second illness I will teach you is diabetic foot ulcers. Because diabetes mellitus affects many body systems like the nerves, blood vessels, muscles, and immune system, a diabetic person more likely to get a foot infection and a wound. Diabetic foot ulcers can be difficult to heal. Once again, illness prevention is always a good thing. This is how you prevent diabetic foot ulcers. Control your blood sugar level. Eat less sugar and take medication to lower your sugar level. Examine your feet daily. Pay special attention to the bottom, heel, and between the toes. Wear well-fitting shoes and remove debris from your shoes before you put it on. Trim your toenails. See your healthcare provider. See a podiatrist if needed. However, if you do get the illness, here is the treatment of diabetic foot ulcers. Your doctor will debride or remove dead tissues from your ulcer. This make wound heal faster. Your doctor will do tests like lab and x-rays. You might have to wear a special boot, medicated gels or creams or dressings, which absorb excess drainage and help wound stay clean, might be used on the diabetic foot ulcer. A bandage will be put on your ulcer to help it heal. The final illness I will teach you about is venous leg wounds. Venous leg wounds are ulcers caused by damaged veins. When a vein is damaged, blood accumulates and causes swelling and weeping. Thus, the skin becomes discolored and looks stained brown. Vein damages can be caused by arterial diseases. These also make the wound harder to heal because they restrict blood flow to the wound. Treatment of venous leg wounds. Your doctor will try to reduce swelling by prescribing special stocking. It is best to do stocking measurement in the morning. You might be asked to use foot sling. Avoid sitting or standing for a long time, and raise your legs periodically. Try not to smoke, and drink alcohol. Keep wound clean and do not scratch. If you itch, talk to your doctor about itch medication. There are many products on the market to treat skin-related illnesses. However, I will only talk about 4. Alginate dressing is an absorbent dressing for use when the wound has moderate amount of drainage. It is available as flat pads or rope. Direction: gently cover the wound with the alginate, then apply an absorbent dressing as gauze. Be sure to change it daily, or when the drainage shows through the outer layer of the bandage. Hydrogel dressing is water or glycerin-based non-adherent dressing that helps keep wound moist. It is available in a tube of gel and in flat sheet dressings. Direction: apply the sheet dressing to the wound door. If using gel from tube, apply 1 inch layer of gel over the surfaces of the wound. You should cover with an absorbent dressing, and then change it when drainage shows on the outer layer of the dressing. Hydrocolloid dressing is an adhesive, moldable wafer which often has a waterproof backing. The adhesive does not adhere to the wound. It is widely used in care of chronic wounds. It is also available in various shapes and sizes. Direction: remove the paper backing and apply the adhesive side of the dressing to the skin. Then, use a dressing at least 2 inches larger than the wound so the dressing can stick to intact skin all around the ulcer. You should change the dressing when the wound drainage reaches the edge or the dressing begins to lift. Wound cleanser is pH-balanced formulas that clean and deodorize the wound. It is an alternative to saline and harsh antiseptic cleansers. Direction: spray the surface of the wound after removing the dressing. Then, dry the surrounding skin before applying the new dressing.